Welcome back, everybody. We're happy that you're back as we continue to explore exam analysis A to Z. You may be one of the many nurse educators that continues to struggle as you explore exactly what these concepts mean. Well, in this series of episodes that we started 2 weeks ago, we will be exploring every single element A to Z that you'll need to focus on to prepare for the CNE exam. Remember that if you are preparing for the CNE clinical, there will not be questions related to exam analysis on your exam. However, if you do have a goal of considering the CNE in the future, then this will be a great review for you. So let's go ahead and jump into our content. Make sure you pull out Billings and Halstead Teaching and Nursing, as well as your study worksheet to ensure that you are closing your knowledge gaps as we talk through the content. C stands for Criterion Reference Test, D is for difficulty, and E is for editing exams. In your textbook, Billings and Halstead, 6th edition, we are pulling content from chapter 25. Starting on page 475 is where you want to start, okay? Because that's where you are introduced to the type of test, which is Criterion Reference Test. And then we will continue to explore norm reference tests when we get to the alphabet N. All right, so let's go ahead and jump into our content that we'll be covering together in this episode. First, we like to take a look at the thought-provoking question. It is the nursing faculty are evaluating the types of evaluation tools they are utilizing across the nursing program. Which statement would be concerning from a faculty member? A, the drug dosage calculation exam passing score should be 90%. B, the sterile technique skills checkoff should be pass or fail. C, the exam should be developed by one faculty member to decrease bias. Or D, the test bank should include a large pool of questions. All right, so those are our 4 options. Think about it. Feel free to pause this episode and come back whenever you're ready to take a look at the rest of the content. Let's start by jumping into having a better understanding related to the Criterion referenced exam. If you take a look in Billings and Halstead on page 475, you're going to see a great description of Criterion referenced exam. So what is it all about, and why is it important for us to use these type of exams? Well, first of all, it measures specific skills and knowledge. An example is going to be med math or the sterile technique skills checkoff. It provides clear feedback to our learners on specific areas of strength and weakness. And thirdly, it encourages our learners to focus on mastery of subject matter rather than competition with peers. So our learners don't have to be concerned about a bell-shaped curve or what that average score is going to be on an exam, because there is a threshold or level of mastery that all students are required to meet in order to be successful or to progress in the program. Okay, so those are some specific details that really do align uniquely with Criterion referenced exams. Now, there are some disadvantages, so let's talk a little bit about those. You've probably already guessed them. First of all, there's limited scope of knowledge that may be related to that specific topic, or there may be a limited focus on that specific area, okay? And then second, the inability to compare student performance. And third of all, it can lead to teaching to the test rather than fostering a deep understanding of the subject matter. Again, going back to that first bullet point of the limited scope of knowledge sometimes that these exams can explore. So why is it important, and what are some key steps for us to take as a nurse educator? Well, the first key step is to analyze the exam results, okay, because it does allow us to share specific feedback with that student so that they can make adjustments and improve their performance to the level of mastery next time. And then second of all, it allows us to give such specific feedback so they're able to pinpoint or target the specific area that will help them achieve success on the assessment. All right, so let's take a look at our thought-provoking question. If you chose C, you are correct. The reason why this was the best answer, because again, we wanted to identify which statement would be concerning, is because according to page 482 as a reference, in order for us to avoid potential bias, we want to collaborate with faculty, right, to review the questions and to make sure the questions make sense, to make sure that the mapping is done correctly. So we actually want to improve the reliability of our exam by collaborating with our peer faculty. All right, so you want to make sure that when you're thinking about content in all of our episodes, to go back to the actual textbook and make sure it makes sense for you. And I want to go back for a second and come back on camera. The reason why it's so important for the content to make sense to you is because remember that the majority of the C&E exam is centered around application and analysis, and then there is a component of recall. When you take a look at the C&E test blueprint, you will see those details laid out. You will also notice in the 23 edition of the Candidate Handbook for the C&E that there have been revisions to the blueprint. We will be highlighting and going deep into exactly what those are in an upcoming webinar, so make sure you stay tuned for that update. We'll send out an email to let everyone know about the free webinar. But again, focusing on application and analysis is huge for those of you taking the C&E clinical. And then for the novice and the C&E, it is focused on recall, analysis, and application. Okay, so you want to make sure that the content you're reviewing here or in any of our programs, that it makes sense to you. And if not, I would just classify that as a muddy point. Go back and look at your resources. Feel free to send us a question via email, or you can always schedule a 15-minute complimentary session with us to kind of talk through the content to help you clear up any of those muddy areas. All right, so now let's go back to the content that we were reviewing. And next we want to transition into D for difficulty. So item difficulty is classified on the scoring report or our exam analysis report based on the p-value, okay? And so you can see the ranges here. It can scale from less than 30, which would indicate a high level of difficulty and that the question was really hard. And it can scale to greater than 80%, which would indicate low difficulty and that it's way too easy, okay? And then we have this sweet spot. Somewhere around 0.7 to 0.8 is average. And if we have a 0.30, that indicates that 30% of the students answer the question correctly. And then at the other end of the scale, 0.80 would indicate that 80% of the students chose the correct answer. Okay, so that's what you want to be considerate of when we think about D for difficulty. It is usually identified on the scoring report based on the p-value. That's the statistical data point. This is just an example of a screenshot of an exam analysis result from a specific software. If you've seen a couple of different exam analysis reports or scoring reports, you know that it really does depend on the layout of that specific technology. But with this specific one, you can see here the p-value is 0.25. That's going to indicate a very high level of difficulty. And then there's some other information that we'll be talking throughout our A to Z exploration over the next several weeks during the summer. I'm looking at the number of test takers. 15 test takers identify that that's an insufficient number because we know we have the ability to increase reliability as we get closer to 25. So many sources cite that we want ideally, 50 or so, but definitely more than 15 test takers. All right, so now let's take a look at the last alphabet for this episode, which is editing. If you want to turn to Billings and Halstead with us, an excellent resource for you related to what those steps are when you think about editing an exam. How do you know when you should? You want to start on page 483, taking a look at box 25.2. But before we get there, we wanted to talk about what are some of these guidelines that you should follow as we are editing a test. So first of all, remember that peer review of questions is helpful, right? We want to collaborate with our peers to refine these questions to ensure that they are accurate questions and that they are readable. Sometimes when we write, especially when we're writing a full exam, sometimes it can be a compressed period of time. The way we read it and the way our learners read it may be two different things. So collaborating with our peers for feedback is a really important step in the process for editing as well as for writing the exam. And then Eliminating grammatical errors, we know that that can also contribute to errors on an exam and a distractor for our students, which could then affect the validity of a test and our reliability. And then last is to complete, when we have our question banks, we want to ensure that we are including a number of questions, a large pool of questions, and that we are using a checklist or a question list to ensure that we are, dotting those I's and crossing those T's to ensure we are providing a fair and reliable exam. So now we can take a look on page 483, box 25.2. These are the listed guidelines for editing a test. So they include asking some of these questions. Do the items align with student learning outcomes in the test blueprint? So ensuring there's strong alignment. Are items stated in a precise manner? Is there one best answer for each item, except, of course, in the example of multiple response items? And we know now there's different types of questions because of next gen, so we want to be mindful of that as well. And then just a few more. Does each item stand alone? That's a really important question to ask ourselves as we're looking at whether or not we did a good job writing exam questions. That's a consideration. And then just a couple more. Has the use of humor been avoided? Has extraneous information been deleted? And has a colleague reviewed the test? So these are all best practices and questions that we want to consider and think about as we are editing a test. All right, so I hope this has been helpful for you all. Feel free to reach out to us at any time, info@drsellerseducate.com. We look forward to seeing you the next time. Have a great one, everybody. Bye-bye.